Hello, my name is Michael Hodapp. As you know, the space industry is growing at an exponential rate. And as we carry man further into space, we must be prepared for all medically related conditions that may occur. And dental is no exception. My goal today is to give you insight into dentistry's role during the space program and to show that although concessions were in place, there were some close calls that could have affected the outcome of the missions. Prevention is the key factor when it comes to spaceflight preparations for crew members. This, however, does not guarantee that there will not be dentally related issues during spaceflight. So sit back in your seats and please join me as we go through dental considerations for spaceflight planning. During the Mercury program, the longest flight was only 34 hours, so prevention was key. When we got into the Gemini program, the flights were lasting a little longer, as much as 2 weeks. So they added a toothbrush to the dental armamentarium. During that period, there were no in-flight dental issues. However, there's a report of at least one non-vital tooth flown on 3 separate occasions. Mind you, each of the astronauts had a maximum of 2 flights each. That tells us there was more than one non-vital tooth flown. In 1966, Major Bill Fromme was assigned to NASA JSC to care for and maintain the health of the astronauts and also the supporting pilots. He also participated in several research projects to determine what's best to treat dental emergencies in spaceflight. And it was determined astronauts needed to treat their own dental emergencies. After all, it was strictly pilots at that point in time. For Project Apollo, these were 2-week missions. So prevention was key, and also they had a small medical kit on board that had medications in case there were any kind of issues. During Apollo, there were no in-flight dental issues. However, there was one pre-flight occurrence of pulpitis and one post-flight occurrence of pulpitis, all within a 90-day period. In other words, 3 months either prior or after flight. That's pretty close. In fact, in the biomedic results of Apollo program, Bill Fromme suggests that this could have caused significant crew member impairment if the pulpitis had occurred during flight. That tells us these were significant cases of pulpitis, which I'm going to cover later. Skylab was America's first international space station. It had first space station, had 3 crews, one that was there for 28 days, one for 59 days, and one for 84 days. And this is the first time we had dental provisions for in-flight dental care. They had forceps for tooth extractions. They had temporary filling material, everything they needed to handle just about every dental emergency. In fact, they even included a conversation piece. That is item number 4, a giggly saw. This obviously was placed by a flight physician because I see no purpose for this in the oral cavity. They received also 2 days of intensive hands-on dental training. One was anesthetic delivery. They were taught how to handle instruments and medications, the reading of radiographs, and how to perform extractions. They also had schematics on board to effectively communicate with ground. They also had a schematic to aid in dental diagnosis in case they lost communication with ground. There were 4 oral health studies in preparation for Skylab, and also there was a Skylab study during the mission. And the results were increased bacterial counts, especially streptococcal and gram-negatives. They had increased calculus and gingival inflammation and increases in salivary IgA. They concluded it was diet rather than flight-related. There were no in-flight dental issues during the Skylab period. However, 6 crew members did require treatment 9 months prior to flight. They had 1 periapical abscess, 1 case of significant gingival inflammation, and a recurrent aphthous ulcer. In 1978, cosmonaut Yuri Romanenko suffered excruciating dental pain on his last 2 weeks aboard Salyut 6. The problem was they didn't have provisions for in-flight dentistry at the time. And he took pain pills and there was no relief. In fact, one of the flight physicians just got frustrated and told him take a mouthwash and keep warm, because he just really didn't have anything else he could tell him. The space shuttle, again, prevention is primary. Now, the space shuttle did dock with this space station Mir, the Russian space station Mir, and this was for 7 missions where we trained with the Russian cosmonauts. This was in preparation for the International Space Station. And they had 2 incidents of caries on board. They were filled with a temporary filling material, and there were no further complications. The space shuttle had 2 pre-flight cases of endodontic therapy, 1 2 weeks prior to flight. They also had a temporary crown that was placed prior to flight, and it was dislodged during flight and had to be luted with calcium hydroxide paste. There were no further complications. In fact, the astronauts were pretty excited because they got to treat a dental emergency in spaceflight, and everything went very well. The International Space Station, of course, prevention is primary, and they all bring their own toothpaste and toothbrush, and some of them even share. There were no in-flight dental issues during the International Space Station right now, and hopefully it will continue that way. For spaceflight preparedness, all astronauts are graded by the standard military dental classification system, and this is based on a 12-month period. To get on board the ISS, you have to be a Class 1, which means you are in good oral health. Class 2 is someone that has some minor oral conditions, but nothing emergent within a 12-month period. In Class 3, that patient needs treatment. Let's get them in. Well, prior to flight, all astronauts get a complete oral exam. They have a panoramic or low-dose 3D CBCT scan. I'll get bite wing radiographs, and we have also included a 780 nanometer near infrared transillumination, and I'm going to explain that here in just a minute. Of course, all defective restorations and caries are treated, and any other pathology that happens to be present. This is near infrared transillumination. It's a real compact USB plug-and-play device, and it can detect caries around existing restorations. What's nice about this, the carious lesions absorb the light and appear dark, just like reading a standard radiograph. And the software places the bite wing image side by side for comparison. Take this one, for example. If you look at this first molar, the lower left first molar, you'll notice there's no sign of any caries anywhere. In fact, the tooth looks perfectly healthy. However, if we go to the 780 nanometer near infrared transillumination image, here's the filling, and you can clearly see there's caries detected all around this filling and along this crack line. So we remove the restoration and the recurrent decay, and as you can see, the crack continues all down into the dentin, and this tooth is going to need a crown. Here's another case. This is comparing to standard bite wing images. And if you'll notice next to this silver filling, there is recurrent decay right here, and same with on the back side. And the near infrared transillumination image is there to confirm that, yes, that truly is decay. However, take this image down below. There is no sign of any decay up here, but the near infrared transillumination image clearly shows decay. So what's happened? We either clearly have a case of fluorosis or a slightly blurred radiographic image. For pre-launch scheduling, all astronauts get semi-annual exams regardless of flight status. 6 months prior to flight, they get a complete oral exam again. And we want to complete all dental treatment 3 months prior to flight to make sure there's not going to be any issues during flight. 2 weeks prior to flight, the crew are quarantined. And they all do get post-flight exams since the missions now are 6 months or longer. So how do we plan for contingencies in low Earth orbit? We use a system called buddy care dentistry. Buddy care dentistry, what we want is something that can be performed by all crew members. You never know who's going to be treating you. It may be a pilot, an engineer, some form of biochemist or scientist. So they all have to be able to treat. And it has to be reversible when possible, because you do not want them doing a procedure and not quite getting it right and then having a bigger problem than what you started with. And aspiration is always a concern. We need to be cognizant the fact in a microgravity environment, the greatest forces in the oral cavity is when a person breathes in and out. And if they're not expecting something be turned loose in there, they could aspirate whatever's in there. Some of the limitations, VOCs, volatile organic compounds. We've got to be careful what we bring up there. We've got to protect that air and water supply. They do not have the capability of opening windows in the harsh environment of space. Also, radiation and moisture content can affect medication effectiveness. Anything they bring up there requires specialized training. We got to keep that in mind. Stowage is always an issue. There's only so much room on the International Space Station or any other capsule that you may be flying your crew members on. And transport. For every pound you want to bring into space, it requires 1,000 pounds of thrust. So that's always a concern. Some of the potential issues in spaceflight can be trauma. Even though we don't have heavy objects, we do have kinetic energy, which is mass and velocity. Also, there's a potential for carries. There could be missed carries or newly formed carries. If you think about radiographs, a radiograph is nothing more than a two-dimensional picture of a three-dimensional object. And unless that image is parallel to the floor of a restoration, you could miss some carries and not detect it. Infections and inflammation, I'm going to cover that here in a few minutes. And also bruxism and clenching is another concern. This is the armamentarium they had aboard the shuttle. And it has forceps, anesthetics, methods to be able to re-cement crowns, things to handle toothache, and also placement of temporary filling materials. This is what it looks like packed up. And then there's a medical checklist and also medication subpack. The ISS has something very, very similar to this. The astronauts are trained in anesthetic delivery, temporary filling placement, what to do with a pulpal exposure, what to do for a crown that came loose and how to re-cement a crown, use of antibiotics, and also how to perform an extraction. They're taught two types of anesthetic delivery. One's the inferior alveolar. It is the most technique sensitive. And there's also infiltration, and that'll cover all the other bases. The inferior alveolar is for the lower mandible. So what do they do with an exposed vital pulp? Well, first they're taught to anesthetize and extirpate as much pulp as possible. Then they want to place this oil of clove and eugenol mixture they have on board and then monitor the tooth. They may have to keep placing that for a while until the tooth calms down, and the tooth eventually will become necrotic. There's also another type of exposed pulp called dry necrosis, and that's when if a cusp fractures off and there is an open canal with no vitality, what you do not want to do is cover that up. You want to just leave that open. It's not painful, and if there's a gas-producing bacteria in there, and you cover that up, you're going to have a much larger problem. For lost fillings, they're taught to explore the floor of the tooth, place temporary filling material, and then adjust the bite. Dislodged crown, basically, if there's no sensitivity, we just tell them to store it away. If it came loose, there's a reason for that, and we don't want it coming loose and then the possibility of aspiration. But if it is sensitive and function and affecting their function, then they can elute it. For the shuttle, they had calcium hydroxide paste. On the ISS, they have a zinc oxide paste to use. For dental infections, of course, the first order of care is antibiotics and NSAIDs, and then monitor the tooth. Now, if you're getting into an extended mission, longer than 2-3 weeks after the infection occurs, then you got to go to the second order of care. And that may be either be return to Earth or extraction and monitor. Normally, when a physician goes on an extended sortie, they will never not bring a scalpel in some way to manipulate tissue. The problem is that will not do anything for a dental infection. You've got to keep that in mind. You need to have some form of instrumentation in order to handle hard tissue. This is a universal forceps. It's a lower universal forceps which can reach every tooth in the mouth. It's not the best device, but it is an effective device that can take care of most extractions. If you just need to have one instrument, a universal lower forceps is the way to go. Dental infections cannot be resolved with antibiotics alone, and that's what's the key issue here. The pulp chamber becomes a protective chamber for the bacteria because there's no blood supply. Antibiotics cannot get in there to kill the bacteria. So the bacteria are free to grow until they finally push out into the bone. And that's usually when somebody realizes they have a problem. You can have an infected tooth for a long period of time in just a quiet state and not know it. And then all of a sudden it starts pushing into the bone, and that's when you know. For lower infections, there's always a complication of having Ludwig's angina, which can close off the airway. For upper infections, the infraorbital foramen does not have any valves, and it's a straight path to the cavernous sinus, which could also be very serious. An acute apical abscess is basically a necrotic tooth that is a rapid onset with a purulent exudate. It's very painful. In fact, a lot of times the tooth hyper-erupts. The patient complains of moderate severe pain. There's usually slight to severe swelling, and the patient usually becomes febrile. As I mentioned, the tooth may erupt into hyperocclusion. What you got to keep in mind is antibiotics are just a temporary measure. You got to have some means of treating that. Pulpitis, there's basically two types, or two major types. There's several types of pulpitis. And basically what this is an inflammation in a closed chamber. There is no place for the increased pressure to go. And so it becomes quite painful in a lot of cases. For reversible pulpitis, it's basically pain with stimulus and it subsides quickly. It's not a major concern. You usually have this from stress when you're clenching your teeth and so forth, or right after a recent dental procedure. Irreversible pulpitis is the problem because it can be in a chronic state and you won't even know it's there. Or it can just all of a sudden become acute. And that's what happened with these on either side of the Apollo missions. Once it becomes symptomatic, it's termed symptomatic irreversible pulpitis. In other words, it's going from a quiescent state to a symptomatic state. And that's when it can be very painful. Usually you'll have sudden paroxysms of pain. It can be localized or diffuse. Sometimes you can't even tell what tooth it is. All they know is they have intense pain on one side of their face and they don't even know where it's coming from. Problem is, antibiotics won't work. Analgesics, including narcotics, are usually inadequate. And sometimes they're difficult to anesthetize. And the only treatment options are root canal or extraction. Here's a dental dilemma. Multiple rooted teeth can be in a transient disease state. In other words, you've got one tooth or one root in that tooth that is totally vital. You've got another one that's necrotic, and then another one that's in a chronic state of irreversible pulpitis. In other words, you don't even know what's going on. And so your pulp testing can give mixed results, or it can give normal results. You cannot even determine it. It's like cancer in its beginning stages. There's no way to detect it. And then all of a sudden it shows up once it gets to a little more extended state. Here's another part to that dental dilemma. The average adult has 28 to 32 teeth. All right. You have one heart. So there's, comparing the two, a 1% chance compared to 28 to 32% chance of something going wrong. Two lungs, you can cut that in half. Now, 12 to 14 of these teeth are multi-rooted. Anytime you have a tooth with a restoration, you see a restoration in the mouth, just know it's either been infected with caries at some point in time, or it's been traumatized for some reason. Everything dentally requires special instrumentation. Here's something else to keep in mind. We tend to go to these reports as far as, Antarctica missions, submarine missions, and so forth to get our data. And just take this submarine study from the 1990s. The incident rate it reports is 5 in 100,000 person days. Doesn't sound significant. In fact, if we calculate that out, it ends up being 0.018 events per person year. That's usually the terms they use in most of these studies. And it sounds like there's really not a problem there at all, and there's really no reason to bring any kind of instrumentation with you. However, read further. That's almost 10% of your required evacuations are for these dental emergencies. Keep that in mind when you're thinking of teeth. Always be prepared. Remember, during Mercury and Gemini, there was at least one non-vital tooth flown during missions. And in Apollo, the pulpitis, both within a 3-month period of mission. Skylab had an apical abscess, also significant gingival inflammation close to the missions. SHUTTLE had 2 cases of caries. SHUTTLE, 2 root canals and cracked tooth prior to flight. Salyut 6, what happens when you don't have provisions? You've got a crew member that cannot function. We are going back to the moon. As a matter of fact, the space launch system, along with the Orion spacecraft, are rolling out to the pad as we speak. They have are building the Gateway Space Station, which will be orbiting the moon, and they will utilize this to go to and from the lunar surface. We need to be prepared for these lunar missions because they're going to be up there for long term. Also, think about this. The commercial space industry is growing at just an astounding rate. These are just a few of the many companies out there that are building spacecraft, space station modules, and so forth to have a presence in space. We need to be dentally prepared as well as medically prepared. Missions to Mars. That's a 3-year minimum mission. It's 9 months to get there, 18 months for the planets to realign, and then 9 months to return. And there is no rapid return. We need to really research this and keep everything planned out so we're medically and dentally prepared. And remember, the communications to and from Mars are delayed 20 minutes each way. That's a total of 40-minute delay in communication. So any kind of emergent conversation you have would be almost useless. So considerations for Mars. With the buddy care system, we really need to incorporate annual exams and cleanings. Also, we may want to have computer-based procedural references and videos. Also, increase the astronaut training. anytime you get into missions that are greater than 3 weeks, you really need to have at least a universal pair of lower forceps, if not additional elevators and, of course, anesthetic and so forth. You need to be prepared. Don't forget to prepare for both medical and dental. Modern diagnostics are getting smaller, so we can perform more procedures in space. They have intraoral cameras that can be used inside and outside the mouth. They have handheld X-ray units about the size of a small camera, battery-operated curing lights. We just don't have bonding materials without VOCs yet. And as I mentioned, 780 nanometer near-infrared transillumination, which minimizes radiation and effectively detects caries. I suggest we should have at least a battery-operated dental handpiece on board when we get into these extended missions. You may have a difficult extraction where you can't possibly remove it with the equipment you have on board, and you just may want to open up that pulp chamber and extirpate the pulp and then treat it that way. Of course, intraoral imaging and 3D printing is already in process on the International Space Station, where they're able to perform some procedures that way. And there's been suggestions of using that in the intraoral cavity. That can be done, but there needs to be enough clearance for the restoration in order to do that. As you know, space exploration is in our future. I mean, it's in our blood. So we need to be not only take preventive measures, but we need to be prepared, both medically and dentally. I want to thank you so much for your time. Thank you for allowing me to present here. I hope you enjoyed this as much as I enjoyed presenting it, and y'all make it a wonderful day. Goodbye, y'all.